Are you ready to pass the NCLEX with confidence? In this video, we're breaking down 50 must-know NCLEX Fundamentals questions, complete with answers, rationales, and strategies to help you think like a nurse. Whether you're just starting out or doing a last-minute review, this quick guide will give you the tools to answer confidently and save time on test day. Stick with me till the end, because each question builds your critical thinking skills, and you don't want to miss the top tips that could be the difference between passing and failing. Question 1. A nurse is preparing to administer a medication to a client. What is the priority action before giving it? A. Check the client's identification band. B. Ask the client to state the medication name. C. Document the medication on the MAR. D. Provide water with the medication. Answer: A. Check the client's identification band. Rationale: verifying patient identity prevents medication errors and ensures client safety. Strategy: safety comes first, always confirm the correct patient before administration. Question 2. A client with pneumonia is receiving oxygen therapy via nasal cannula. Which finding shows therapy is effective? A. Respiratory rate of 28 per minute. B. Oxygen saturation of 96%. C. Complaints of shortness of breath. D. Diminished breath sounds. Answer: B. Oxygen saturation of 96%. Rationale: oxygen therapy is effective when oxygenation improves, measured by SpO2. Strategy: choose the answer that reflects the goal of the intervention. Question 3. What is the best way to prevent healthcare-associated infections? A. Wearing gloves with every client contact. B. Giving prophylactic antibiotics. C. Performing hand hygiene before and after client care. D. Isolating all clients. Answer: C. Performing hand hygiene before and after client care. Rationale: hand hygiene is the single most effective infection prevention measure. Strategy: on NCLEX, hand hygiene is nearly always the correct answer for infection prevention. Question 4. A nurse finds a client on the floor after an unwitnessed fall. What should the nurse do first? A. Help the client back to bed. B. Assess the client for injuries. C. Notify the provider. D. Complete an incident report. Answer: B. Assess the client for injuries. Rationale: assessing prevents further harm before moving the client. Strategy: in fall scenarios, assess first, then act. Question 5. How should a nurse instruct a client to use an incentive spirometer? A. Exhale forcefully into the device. B. Inhale slowly and deeply through the mouthpiece. C. Hold your breath while exhaling. D. Use it only when you feel short of breath. Answer: B. Inhale slowly and deeply through the mouthpiece. Rationale: the device promotes lung expansion by encouraging deep inhalation. Strategy: remember, incentive spirometer equals inhale. Question 6. A surgical client makes this statement. I will keep taking my herbal supplements before surgery. What should the nurse do? A. Reinforce NPO after midnight. B. Explain that some herbal supplements may increase surgical risks. C. Ask the client to bring supplements to surgery. D. Say nothing unless the provider asks. Answer: B. Explain that some herbal supplements may increase surgical risks. Rationale: herbs like ginkgo, garlic, or ginseng increase bleeding or interact with anesthesia. Strategy: identify unsafe client statements that need correction. Question 7. A client with a stage 2 pressure injury needs which type of dressing? A. Dry sterile gauze. B. Moisture retentive, hydrocolloid, dressing. C. Hydrogen peroxide soaked gauze. D. Open air exposure. Answer: B. Moisture retentive, hydrocolloid, dressing. Rationale: stage 2 wounds require a moist environment to promote healing. Strategy: think moist wound healing, not drying or harsh solutions. Question 8. For NG tube insertion, which position is best? A. Supine with head flat. B. High Fowler's position. C. Side lying position. D. Trendelenburg position. Answer, B. High Fowler's position. Rationale, upright positioning reduces aspiration risk and aids tube passage. Strategy, when airway or swallowing is involved, choose upright positioning. Question 9. Which finding in dehydration requires immediate intervention? A. Dry mucous membranes. B. Urine output of 20 milliliters per hour. C. Capillary refill of 3 seconds. D. Complaints of thirst. Answer, B. Urine output of 20 milliliters per hour. Rationale, output less than 30 milliliters per hour indicates inadequate kidney perfusion. Strategy, pick values that show life-threatening organ compromise. Question 10. A client with a stroke has dysphagia. Which action by the nurse is correct? A. Offer thin liquids through a straw. B. Place food on the unaffected side of the mouth. C. Encourage eating while lying flat. D. Offer large bites of solid food. Answer, B. Place food on the unaffected side of the mouth. Rationale, this reduces aspiration risk and promotes safe swallowing. Strategy, focus on safety. Prevent aspiration in dysphagia clients. Question 11. Which sign is the earliest indicator of fore infiltration? A. Coolness at sight. B. Pain at sight. C. Edema of the arm. D. Blood return absent. Answer, A. Coolness at sight. Rationale, fluid in tissues lowers temperature before pain and swelling occur. Strategy, for earliest sign questions, look for subtle changes first. Question 12. A client receiving warfarin should avoid which food? A. Oranges. B. Spinach. C. Apples. D. Bananas. Answer, B. Spinach. Rationale, spinach is high in vitamin K, which decreases warfarin effectiveness. Strategy, for anticoagulants, think vitamin K, green leafy vegetables. Question 13. A postoperative client has shallow respirations. What should the nurse do first? A. Give opioid for pain. B. Encourage deep breathing with incentive spirometer. C. Elevate head of bed. D. Apply 2 liters per minute oxygen. Answer, B. Encourage deep breathing with incentive spirometer. Rationale, expands alveoli and prevents atelectasis. Strategy, choose interventions that address the cause, not just symptoms. Question 14. A client repeatedly removes oxygen cannula. What should the nurse do first? A. Restrain the client's hands. B. Reapply cannula later. C. Assess oxygen saturation and mental status. D. Tape cannula tightly. Answer, C. Assess oxygen saturation and mental status. Rationale, pulling may indicate hypoxia or confusion. Strategy, always assess before intervening. Question 15. Normal potassium range is A. 2.5 to 4.0 milliequivalent/L. B. 3.5 to 5.0 milliequivalent/L. C. 5.5 to 7.0 milliequivalent/L. D. 1.5 to 3.0 milliequivalent/L. Answer, B. 3.5 to 5.0 milliequivalent/L. Rationale, potassium outside this range can cause cardiac problems. Strategy, memorize common electrolyte values, they are tested frequently. Question 16. A client with a tracheostomy suddenly has gurgling sounds and difficulty breathing. What is the priority? A. Apply oxygen mask. B. Suction the tracheostomy. C. Replace the tracheostomy tube. D. Increase humidification. Answer, B. Suction the tracheostomy. Rationale, gurgling equals secretion blockage, suction restores airway. Strategy, think airway first. Question 17. Before blood transfusion, what must the nurse do first? A. Warm blood to body temperature. B. Start infusion with D5W. C. Obtain consent and baseline vitals. D. Give 4 steroids. Answer, C. Obtain consent and baseline vitals. Rationale, required safety steps before starting transfusion. Strategy, consent and vitals always come first in transfusions. Question 18. Which task can be delegated to a UAP? A. Insert Foley catheter. B. Measure post-void residual with bladder scanner. C. Assess bladder distension. D. Teach catheter care. Answer. B. Measure post-void residual with bladder scanner. Rationale, non-invasive and technical, assessment and teaching are RN duties. Strategy, delegate routine, non-assessment tasks. Question 19. Which client should the nurse see first? A. Post-op pain score 8 out of 10. B. O2 sat 85%. C. Wound with red drainage. D. UTI with dysuria. Answer. B. O2 sat 85%. Rationale, oxygenation comes before pain or infection. Strategy, apply ABCs, airway, breathing, circulation. Question 20. An elderly confused client wanders at night. Best nursing action? A. Apply restraints. B. Use bed/chair alarms. C. Give sedatives. D. Lock the room. Answer. B. Use bed/chair alarms. Rationale, least restrictive, promotes safety. Strategy, on NCLEX, least restrictive and safe intervention is usually correct. Question 21. Which PPE is required for a client with tuberculosis? A. Surgical mask. B. N95 respirator. C. Gown and gloves only. D. Face shield only. Answer. B. N95 respirator. Rationale, TB is airborne, requires N95 and negative pressure room. Strategy, airborne equals N95, droplet equals surgical mask. Question 22. Which intervention prevents pressure injuries in a bedridden client? A. Repositioning every 2 hours. B. Keeping heels flat on bed. C. Restricting fluids. D. Massaging reddened areas. Answer. A. Repositioning every 2 hours. Rationale, regular turning relieves pressure. Strategy, preventive care equals repositioning, not massage. Question 23. Who should the nurse see first? A. Client with pain 8/10. B. Client with chest tube and dyspnea. C. Client awaiting discharge teaching. D. Client with blood sugar 150 mg per deciliter. Answer. B. Client with chest tube and dyspnea. Rationale, breathing difficulty takes priority. Strategy, apply ABCs, airway, breathing, circulation. Question 24. Correct sequence for removing PPE? A. Gloves, gown, goggles, mask. B. Gown, gloves, mask, goggles. C. Mask, gloves, gown, goggles. D. Goggles, gloves, mask, gown. Answer. A. Gloves, gown, goggles, mask. Rationale, remove most contaminated, gloves, first, mask last. Strategy, remember, gloves off first, mask off last. Question 25. Which statement by a post-op client indicates correct DVT prevention? A. I'll avoid moving my legs. B. I'll cross my legs when sitting. C. I'll do leg exercises and wear compression stockings. D. I'll drink less water. Answer. C. I'll do leg exercises and wear compression stockings. Rationale. Promotes circulation, prevents clot formation. Strategy, select proactive, preventive action. Question 26. What type of isolation for Clostridium difficile? A. Standard. B. Contact. C. Droplet. D. Airborne. Answer. B. Contact. Rationale, spread by spores, gloves, gown, and soap plus water. Strategy, C. Diff equals contact plus soap and water. Question 27. For site is red, swollen, and painful. What should the nurse do first? A. Apply warm compress. B. Discontinue 4. C. Flush with saline. D. Document. Answer. B. Discontinue 4. Rationale: stop infusion to prevent complications. Strategy: remove cause before comfort care. Question 28. Purpose of advance directives? A. Only used in nursing homes. B. Allows client to state healthcare wishes if unable to speak. C. Written only by family. D. Same as a living will and cannot be changed. Answer: B. Allows client to state healthcare wishes if unable to speak. Rationale: gives clients autonomy in decision-making. Strategy: look for answer that supports client rights. Question 29. Which client needs immediate attention? A. Potassium 3.8 milliequivalent/L. B. O2 sat 82%. C. BP 150/88 mmHg. D. Glucose 105 mg per deciliter. Answer: B. O2 sat 82%. Rationale: critical hypoxemia requires urgent care. Strategy: always prioritize airway/oxygenation. Question 30. How to prevent infection in a client with central line? A. Keep catheter uncovered. B. Wash hands before touching line. C. Shower freely with site unprotected. D. Flush line only if clogged. Answer: B. Wash hands before touching line. Rationale: hand hygiene is key in preventing infection. Strategy: hand hygiene is almost always correct. Question 31. Which diet is best for a client with dysphagia? A. Thin liquids with straw. B. Thickened liquids. C. Large bites of solid food. D. Water only. Answer: B. Thickened liquids. Rationale: thickened liquids reduce aspiration risk. Strategy: prioritize aspiration prevention. Question 32. UAP offers NPO client water before surgery. Best action? A. Report UAP to supervisor. B. Re-educate UAP about NPO order. C. Allow small sips. D. Ignore. Answer: B. Re-educate UAP about NPO order. Rationale: education prevents recurrence. Strategy: choose education before punishment and less severe harm. Question 33. Which prevents venous thromboembolism in bedrest client? A. Encourage ambulation as tolerated. B. Massage calves. C. Apply ice packs. D. Restrict fluids. Answer: A. Encourage ambulation as tolerated. Rationale: mobility promotes circulation. Strategy: immobility equals clot risk, ambulate when possible. Question 34. Before giving digoxin, nurse must check: A. Respiratory rate. B. Apical pulse. C. Blood pressure. D. Temperature. Answer: B. Apical pulse. Rationale: hold of HR less than 60 bpm. Strategy: always check pulse with digoxin. Question 35. Fire in client's room, what's the first action? A. Extinguish fire. B. Sound alarm. C. Rescue client. D. Close door. Answer: C. Rescue client. Rationale: follow race, rescue, alarm, contain, extinguish. Strategy: save lives before property. Question 36. Normal sodium range? A. 110 to 120 milliequivalent/L. B. 135 to 145 milliequivalent/L. C. 150 to 160 milliequivalent/L. D. 125 to 130 milliequivalent/L. Answer: B. 135 to 145 milliequivalent/L. Rationale: normal serum sodium is 135 to 145. Strategy: memorize electrolytes, they're frequently tested. Question 37. Confused client pulls on Foley catheter. Best action? A. Apply restraints. B. Educate client about catheter. C. Cover tubing with protective device. D. Remove catheter without order. Answer: C. Cover tubing with protective device. Rationale, least restrictive option first. Strategy, choose safest, least restrictive action. Question 38. Safe ambulation with walker? A. Push walker then step into it. B. Move strong leg first. C. Carry walker upstairs. D. Lean heavily on one side. Answer, A. Push walker then step into it. Rationale, walker should always support client before stepping. Strategy, use device first, then move. Question 39. Which finding requires immediate action? A. Rate 60 milliliters per hour. B. Cool, swollen site. C. Transparent dressing intact. D. Tubing labeled. Answer, B. Cool, swollen site. Rationale, indicates infiltration. Strategy, prioritize complications like infiltration/phlebitis. Question 40. Client has BP 80/50ths and dizziness. First action? A. Recheck in 1 hour. B. Trendelenburg position. C. Notify provider. D. Assess airway, breathing, circulation. Answer, D. Assess airway, breathing, circulation. Rationale, assess before intervening or calling. Strategy, ABCs first. Question 41. Which statement shows poor infection prevention? A. I'll wash my hands before eating. B. I'll take all antibiotics prescribed. C. I'll share towels with my family. D. I'll cover my mouth when coughing. Answer, C. I'll share towels with my family. Rationale, sharing spreads infection. Strategy, pick the unsafe statement. Question 42. Who is most at risk for pressure ulcers? A. 25-year-old ambulatory. B. 70-year-old hip fracture on bed rest. C. 45-year-old with hypertension. D. 60-year-old with controlled diabetes. Answer, B. 70-year-old hip fracture on bed rest. Rationale, immobility plus advanced age equals highest risk. Strategy, think immobility plus frailty equals highest risk. Question 43. Which is correct for seizure precautions? A. Place tongue blade at bedside. B. Keep padded side rails up. C. Restrain client during seizure. D. Insert airway during seizure. Answer, B. Keep padded side rails up. Rationale, prevents injury, never insert objects in mouth. Strategy, safety plus injury prevention are priorities. Question 44. Nurse sees UAP ambulating client without gait belt. Best action? A. Document observation. B. Stop and educate UAP. C. Report to management. D. Ignore if client safe. Answer, B. Stop and educate UAP. Rationale, client safety is immediate concern. Strategy, intervene in real time for unsafe practice. Question 45. Which promotes sleep in hospital? A. Keep lights on. B. Offer warm caffeine-free drink. C. Give sedatives routinely. D. Encourage frequent naps. Answer, B. Offer warm caffeine-free drink. Rationale, relaxation aids sleep, caffeine/naps disrupt it. Strategy, try non-drug comfort measures first. Question 46. Best food for constipation? A. White rice. B. Cheese. C. Apple with skin. D. Mashed potatoes. Answer, C. Apple with skin. Rationale, fiber helps relieve constipation. Strategy, high fiber foods equals best for constipation. Question 47. Which statement about walker use is correct? A. I'll push the walker ahead and then step into it. B. I'll move my strong leg first. C. I'll carry the walker upstairs. D. I'll lean to one side while walking. Answer, A. I'll push the walker ahead and then step into it. Rationale, proper technique equals walker first, then step. Strategy, assistive devices always used before stepping. Question 48. Which client teaching prevents urinary tract infection? A. Wipe back to front. B. Void after intercourse. C. Limit fluids. D. Hold urine as long as possible. Answer: B. Void after intercourse. Rationale: voiding flushes bacteria from urethra. Strategy: choose option that reduces bacterial entry. Question 49. Client on clear liquid diet may have A. Ice chips and broth. B. Milk and yogurt. C. Oatmeal and toast. D. Mashed potatoes. Answer: A. Ice chips and broth. Rationale: clear liquids equals transparent at room temp. Strategy: memorize broth, tea, juice, gelatin, popsicles. Question 50. Client receiving opioid 4 develops shallow breathing, 8 per minute. Priority action? A. Notify provider. B. Administer naloxone. C. Reassess in 30 minutes. D. Increase 4 fluids. Answer: B. Administer naloxone. Rationale: naloxone reverses opioid-induced respiratory depression. Strategy: in opioid toxicity airway and naloxone first. Congratulations! You've just completed 50 high-yield NCLEX Fundamentals questions. Remember, success on the NCLEX isn't about memorizing answers, it's about understanding why. If you found this helpful, hit that like button, share with your study group, and don't forget to subscribe for more quick and easy NCLEX reviews. I recommend checking out my video on NCLEX priority questions. Who do you see first? It's a game changer for test day. Thanks for watching, and I'll see you in the next one. Your NCLEX success story starts here.